Hello, you guys. My name is Yesenia Bud, and we are going to be talking about a disease called brucellosis. So, the objectives that we are going to be covering is learn what causes this disease to occur, what species are affected by this disease, and what ways it is transmitted, symptoms, actions that we can take to prevent it, treatment methods for this disease, the zoonotic status, the geographical occurrence, and any local cases found in the previous years. So, what is brucellosis? So, brucellosis is an infectious disease caused by a bacteria called Brucella. And they look like short rods, like in this picture, short, long, kind of long rods. They come from the family Brucellicaceae, also known as undulant fever, Malta fever, Gibraltar fever, Bang's disease, or Mediterranean fever, but we mostly know it as brucellosis. So, is it a zoonotic disease? Yes, it is. Brucella spreads from animals to humans, which means it's zoonotic. And it can also go from animal to animal. This can happen through contact of an infected animal or its product, for example, meat, which we will talk about transmissions later in the video. So who are affected by this disease? A lot of domesticated animals out there are affected, such as cattle, goats, sheep, horses, swine, and dogs. The main domesticated animal that is affected is cattle. This also includes most wild animals like deer, wild hogs, wild dogs, etc., and humans, which is us. So the transmission, how can it be transmitted, is mainly by these four common ways, such as consumption of unpasteurized dairy products like raw milk, consumption of not fully cooked meat, inhalation of contaminated air, skin contact with infected animals. So the consumption of unpasteurized dairy products, unpasteurized means that it's unprocessed, raw, that have not been treated with mild heat. Mild heat helps eliminate any pathogens that are within that product. This is the most common way to get transmitted with brucellosis, by eating or drinking unpasteurized dairy products, such as milk, ice cream, butter, cheeses, which they all come from milk. And milk comes from cows, which cows are the main domesticated animals that have brucellosis. Brucella bacteria can appear in the milk of these mammals, not just cows, but also sheep and goats. The milk is contaminated when the animal is infected, and then it is sold to people unpasteurized, which some people prefer unpasteurized milk actually, for reasons of it being healthier, more natural, and they're away from GMOs. So as you can see in this picture, we have raw milk, which is also known as whole unpasteurized milk. It is soy-free, grass-fed, RBST-free, and etc. And of course, here's a government warning saying that it may contain any disease-causing microorganisms, which one of them can be Brucella bacteria. So the consumption of uncooked meat. So animals that were once slaughtered may have been infected with brucellosis before. By infected, we mean brucellosis, the bacteria Brucella, may be in the muscle tissues. And if they're in the muscle tissues and all of these meats products are being sold to other people and people are not fully cooking these meats, well, that means they're not really killing the bacteria completely. So the cooking process kills any harmful organisms, which is why it's important to always cook your meat thoroughly. Then we have aerosol exposure and direct contact. So aerosol exposure is the inhaling air containing particles, including bacteria, that may cause health problems. This is a way that Brucella can spread, which is air, and can happen quickly. Direct contact with body fluids from an infected animal is also another way to be transmitted. So bodily fluids may be like the blood, semen, the placenta fluids, animal excretions, basically, from newborn animals during birth. And Brucella bacteria in these fluids may enter skin wounds and mucous membranes. So the way it is transmitted is that if you have any skin wounds while you're being in contact of any blood, semen, or placenta fluids from an animal, and you are not wearing any protective gloves or anything to cover it, then this bacteria can enter in the skin wound and infect it, such as this picture right here. But it does not include any normal direct contact, for example, like brushing their hair or playing with the animal, anything that does not encounter any bodily fluids and breakage of the skin. So the people who are at risk are veterinarians, slaughter workers, dairy farmers, hunters, and ranchers. Mostly people who are dealing with animals that are prone to this disease, and they're dealing with them on a daily basis. So here are some symptoms. And these symptoms are very similar to having the flu, which is sometimes a reason why it's harder to detect if you have brucellosis because of the similarity of the symptoms, such as fever, sweats, loss of appetite, such as anorexia, getting headaches, fatigue, chills, joint muscle and back pain, and joint muscles such as like arthritis. So how to prevent it? Well, you would prevent it by avoiding consuming unpasteurized dairy products or any undercooked meat. Also, take any recommended or required safety precautions, especially if you work in a lab that deals with any animals or any bacteria. You must wear your gloves, goggles, and or aprons when in contact with any bodily fluids from possible infected animals, living or not. And by living or not, I mean like living if you are handling a mother cow who is giving birth to a calf and you're dealing with their bodily fluids, and those bodily fluids that may contain the bacteria Brucella, you should definitely wear some gloves so you aren't exposed to it and at risk. And for not living, well, if you're dealing with any meats, cutting any meats that have blood still in it during the slaughterhouses, that meat that came from an animal can be infected by Brucella also. So you should always be careful and be wearing this equipment. So handle laboratory substances like bacteria carefully. So like I said, just be careful with them and use protection. And always make sure to always wash your hands. Another one is to vaccinate your domesticated animals. If there's a vaccine for brucellosis in that country, then you should definitely take advantage of that too. So treatment methods, you must be diagnosed by a doctor first. Some tests will be performed to search for this bacteria and see if you have Brucella bacteria. They may take your blood, bone marrow, or any other bodily fluids required. And then if you do have it, they may prescribe you to any antibiotics, which is a common solution to fight the Brucella bacteria. And the amount of time to recover does depend on the severity and the person's immune system, so it varies person to person, and death is rare. Geographical occurrences, it is rare to occur in the United States, unlike other countries such as the following: Mexico, South and Central America, Asia, Africa, the Middle East, the Caribbean, South Europe, such as Portugal, Spain, Turkey, Italy, Greece, Southern France, So many of these countries that are listed above may not have the programs that are provided in the US, which in the US they help to aid in the animal and human health to fight maybe brucellosis specifically. And some of these aren't given in these countries. So any local cases around here, there really aren't as many local cases in the United States because it is rare and isn't as common in other countries that were listed previously. So approximately 80 to 120 brucellosis cases are reported every year, but it isn't as much as other countries. Most are due to consuming unpasteurized milk, which is a very, very common way to be transmitted. 75% of the states have laws that allow only certain raw milks to be sold because of this contamination that you can get. The U.S. State Federal Cattle Brucellosis Eradication Program is a program that specifically focuses on brucellosis and creates ways and regulations to prevent having brucellosis being common in the United States. And that is it for my presentation. Thank you so much for listening, you guys.